Welcome to the WhiteGlove Healthcare solution to the high cost of workers' compensation administration. It's plain to see that today's costs are skyrocketing. With rising premium rates, medical fees, and the high cost of lost time on the job, every company needs to find better, more affordable ways to manage worker comp costs. Simply put, today's system is broken. Reports show that as many as 2/3 of all workplace injury claims may have been unnecessary, since they were minor in nature. Bruises and contusions, sprains and strains, soreness or pain, all are injuries which could have been classified as first aid care only. Companies continued to rely on non-medical personnel to provide injury treatment advice and to complete the necessary paperwork associated with workplace injuries, leaving them open to costly administrative errors and potential fines. With these hurdles in mind, WhiteGlove Health has created a new solution that, in the case of an on-the-job injury, ensures that your employees are well taken care of and back on the job as soon as possible, all while saving your company significant financial resources and reducing your medical and legal risks. The WhiteGlove Health nurse triage approach is the same solution utilized by today's military, ensuring the health of the patient while getting them back to active duty as soon as possible, and without engaging them in additional services that may not be necessary. Here's how the WhiteGlove Health nurse triage solution works. When a workplace injury occurs, the injured employee or supervisor will call their company's dedicated toll-free number, available 24 hours a day, 365 days a year, and speak to a registered nurse, specifically trained to respond and triage injuries in the workplace. During the call, the following steps will occur. First, the registered nurse will assess the injury to recommend the proper level of care. Second, if the injury is an emergency, the registered nurse will instruct the caller to immediately call 911. After the situation has stabilized, a call is made to WhiteGlove Health to document the injury. Third, if the injury is not an emergency, the registered nurse will guide the employee to administer first aid care or refer them to the nearest clinic for treatment. In addition to referring the employee to the most appropriate level of care, the registered nurse performs the following administrative steps. First, the registered nurse will complete all the necessary paperwork to properly document the injury, including state-mandated forms. We can even complete your OSHA log and handle that filing if you like. Second, the completed forms will be distributed electronically to all required internal and external personnel. Third, the registered nurse will even notify outside healthcare providers of the pending employee visit. And fourth, all calls are recorded for the safety of your employee and your company. What are the results and benefits of the WhiteGlove Health nurse triage solution? First, medical and lost time claims are reduced by 44%. Next, all mandatory documentation completed properly and on time by medical personnel. All medical decisions are made by licensed medical providers 24/7, 365 days a year. Lower EMOD ratings and reduced premium costs, and lower financial, medical, and legal risk. Call WhiteGlove Health today and find out how our nurse triage solution can save your company significant financial resources, reduce your medical and legal risk, and help keep your employees healthy and productive. Call today at 972-310-9182 or email sales@whiteglove.com. At WhiteGlove Health, we look forward to becoming partners with you and your company. Together we can assist employees who are injured on the job while providing your company with a solution that keeps you in control of your workers' compensation costs. Thank you for your kind attention.